Here in Nigeria, the government is explaining its helplessness in the face of gross violations of COVID-19 safety protocols, saying the nation's health system is currently struggling to cope with the increasing number of infections daily. While it projected that January 2021 would be tough in terms of managing the pandemic due to continued safety violations during the Yuletide, it announced its decisions to confiscate over 100 international passports of travelers who evaded the Day 7 post-arrival PCR test. This came as the Federal Capital Territory Administration, FCTA, threatened to shut down markets and other business ventures in the territory for violating the safety protocols. During the briefing of the Presidential Task Force, PTF, on COVID-19, Director General of Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekweazu, said Nigeria would next month pay the price of violating the protocols during the festivities. For more on the COVID-19 update in Nigeria, we're now joined by Infectious Disease Specialist Dr. Joseph Onigbinde. You're welcome, Doctor. So, Doctor, we're just hearing now that Good afternoon, you're welcome. So we're just hearing almost like naughty students that we are bound to pay the price for our bad behavior. Is that all there is to this spike? Are we being, do you say, transparent when it comes to deciphering the cause of this spike?
Well, it is true that we are bound to pay the price. Like we now having second wave of the COVID becoming very serious, perhaps even more serious than the first wave. You see, when we have pandemic like we are handling right now, one of the problems we have is this second wave, because people will let down the guards, all the preventive measures that they were following before. They think, oh, we are okay, we're in control, we are no longer at risk. So they let down their guards, and that is what always happens. That's exactly what we are going through right now. From what we've had now, we've had some very severe second wave infection being more rapid than the first wave. So we have to get up again and start afresh. That's what I feel. You see, I saw a video recently where Nigerians were doing parties in the market. It was very sad. No social distancing, all those precautions that we had, safety precautions we had before, they've been thrown aside. And that is why we are having what we're having right now. So I think we have to readdress the issue, and then probably at our airports too, all the precautions and all the protocols we have to be seriously observed. Now that we even had some strains that are in the UK, South Africa, which are much more aggressive.
Here in the South Africa stream. But you said something. You said start afresh. I want you to take that deeper. But before that, now the DG, Chikwe Ihekweazu, is actually being brutally, that's the way I say it, brutally frank when he says that come January, it will be very tough because the health systems here in Nigeria are being overstretched. He actually said he's struggling to cope with the increasing number of coronavirus cases. So my question is, what should we be doing now that the situation is that way? And what do you mean by starting afresh?
Well, what I mean by starting afresh is all the precautions that were given out to people, safety precautions that were doing, social distancing, washing of hands with soap and warm water, with water, and then hand sanitizers. We have to start and be very serious on them again, because as it is now, we have let down our guards, and the thing is now the infection is now on us very seriously, much more than before. So I think we have to go around all the schools, and the information has to be out again, and then probably we have to do some lockdown. I don't know. I think maybe we have to do some lockdown to be able to cope with this second wave.
Doctor, perhaps what I was hinting at when I said that we're being transparent is, could you talk to us a bit more about the variant strain? The write-up we came across was to do with the fact that the strain may have been in Nigeria from as early as August, and we're only just beginning to out it, so to speak. So could that be having some impact on the spread? Apparently, some figures put it at the jump was from 3,000 to over 10,000 in the month of November. So could that account for such a spike?
Possibly. I learned it. The strain has been with us from August, like you rightly said, and maybe because we have not been very careful about it. The new strain I know is more aggressive. It may not be more. It's more infectious, but the consequences, the mortality may not be worse than before, but it's definitely more aggressive. So that is why we have to sit up at this time. It has been with us since August, like you rightly mentioned, but we're not careful about it. We're just doing things with levity.
All right, Dr. Joseph Onigbinde, we are going to have to keep you on pause. We'll get back to you after this time out. Stay with us.
You're still watching Newsday, and we still have with us Dr. Joseph Onigbinde, and we're just talking about the state of our health in light of COVID-19 infection. So, Doctor, just in that time out, my colleague and I were just talking about testing, and I want to put it to you. Is it likely that we're seeing increased cases because of increased testing?
Oh, most likely. I think even right now, we're not even doing enough testing. We've done less than 1 million tests from a population of over 200 million. I think we've not done enough testing. Possibly the increase that we're seeing is because we are doing more testing, and then maybe our authorities are being more honest at this time, because I must tell you that the whole issue around COVID has been very, very suspicious. We are not trusting each other. We are not doing enough testing, and some people and the data collection also not good enough. Some people just in the villages, people die anyhow. They don't know. This is just an attack, whereas they died of COVID. So I even said we are not even reporting enough of deaths and of COVID infections. So maybe we are doing more testing now, and I still want to advocate that we should do more testing. By now, I expect that Nigeria should have gone over 2 million testing, but we have not even done up to 1 million testing, which is poor enough.
Well, okay, let me still stick.
Be that as it may, I also say that we have to also reinforce all the protocols we have at our international airports, maybe Lagos and Abuja, especially since we now have new strains and very virulent strain from UK. We have to stop. We have to close our borders. I was one of those who advocated that we should close our borders against international flights as early as February. But our reaction was not so swift enough. We are vacillating until, I'm not saying that's exactly what happened, but I think if we have done it so earlier, maybe we will not have what we're having right now. So I think our government should please act very swiftly now and ban in-flights from UK. At least over 42 countries have stopped flight from UK. So I don't know what Nigeria is still waiting for.
All right. Well, I think the government is already doing something. But let me stick with this question of testing. It's interesting to note that the federal government is disappointed in some of the states. Their disappointment is for low testing. And the federal government is saying this is in spite of the resources made available to the states, and still their testing is very low. Doctor, this is definitely a no-no. Why do you think the states are still engaged in low testing?
It's still the same situation. The cankerworm that has eaten deep into the fabric of our society is corruption. So they will. I'm disappointed that the federal government is saying that they have given them all the income and everything that they needed. Yet these tests are not done. Just because they want to embezzle money, they want to embezzle funds, and they are putting the life of our people at risk, which is very sad. So it is because of corruption, I think.
Okay, well, that's your opinion, Doctor. But I want to also talk about the issue of trust, which you raised. And that's to say, a community doctor once said that the reason people are not so compliant is because of that issue of trust, that people have politicized the message of the COVID-19, whereas normally they would trust their doctors. They find it hard to trust this message. Have you encountered that? Because clearly we need to look ahead and say, how do we get more buy-in when it comes to compliance if people are still having issues? Some argue that, maybe malaria has killed more people than COVID-19, so why the drive towards COVID-19? Please, can you speak on that, Doctor?
Well, I think I also blame, though we've been blaming government, but we also blame ourselves, the population. A lot of theories are going around now, conspiracy theories that COVID is not even Nigeria. Why not about COVID? Why not about malaria? Why not about typhoid? These have been killing us for years. But we should also know that this time, this is not, this time is the whole world that is involved. And we cannot say Nigeria is not good enough. We are not seriously affected like in UK or Europe, because Europe or America, probably because of the transferred immunity that we had from all these infections we had in the past. But we have to talk to ourselves too. A lot of information still have to go to the community. We have to cultivate our community that it is true. COVID is real, and please go out and do testing. A lot of people that came in through overseas and they are asked to come and do testing after 7 days, they have not done it because some of them don't even believe that COVID is, because of what is going on in the society. The belief around the society is that COVID is not in Nigeria, it's a political movement. But I think it is wrong. I think we need to do more of awareness campaign to let people know that we need to please sit up and get tested for COVID.
All right, Doctor, you talked about the UK strain and the South Africa strain. Additional quarantine measures have been rolled out. That's according to Boss Mustafa, the chairman of the PTF on COVID-19. What do you make of this? Also, the fact that starting from January 2021, passports of the first 100 passengers that failed to take their day 7 post-arrival PCR test will be published in the national dailies. And not just that, the passports will be suspended. What's your sense of this?
Say that again. Please come again. You said,
well, the government is
to be suspended.
Yeah, but the government is saying that if you fail to take your COVID test, your PCR, your passports, the post 7 days coming in, your passport will be published, your names will be published in national dailies, then your passport going further will be suspended. And additional quarantine measures have been put in place for people like this. So what's your sense of what the government is doing, this action they are taking? Briefly.
Well, I think that is not bad. That will keep us straight, because like I said, most of these people don't even believe that there is COVID anywhere, either in Nigeria or even outside the country. They think it's political. So I think that action, harsh as it may sound, is a bit on the right side. I think they should take some stiff measures to stop people from going against all the orders, all the instructions of the health officials. So that is not bad. And you said such people will also go into quarantine. Is that what you mean?
Yeah, he said they have rolled out extra quarantine measures, for such people.
Well, I mean, it's of no use to do quarantine again. They've been in the country for over 2 months or thereabout. So doing extra quarantine does not have any serious influence of them. If any of them will come down with COVID, they should have come down with COVID since that time. So putting off extra quarantine, I think is in order. They don't need to quarantine such people again. But the measure to suspend their passport, and it's like a warning to others who might still be thinking of doing such a thing when they are coming in, to show that you are very serious about this control against the COVID infection.
Yep.
Okay. Thank you very much, Doctor. That's all we have time for. Thank you.